Hello, everybody. I'm Klaus Mergener. I'm the Vice Chair of the ASGE Foundation Board of Trustees, and I'm a physician in private GI practice in Tacoma, Washington. Today, I have the honor of visiting and speaking with Dr. Bergein Overholt here in Knoxville, Tennessee. Dr. Overholt, as many of you know, is one of the most accomplished gastroenterologists in our specialty. Dr. Overholt has been president of the ASGE. He's the recipient of their Schindler Award for developing the flexible sigmoidoscope. He went on to found one of the premier GI practices in the country. He opened one of the first ASCs in the country and the very first ambulatory endoscopy center. He researched photodynamic therapy and Barrett's therapy, and the list goes on and on. So without further ado, Gene, thank you for making time for us and for spending a little bit of time talking about your life and your career.
My privilege, thank you.
For those poor souls who have never been to Knoxville, Tennessee, maybe we'll start by you telling us a little bit about the city that I think you were born in and have lived most of your life.
Actually, I was born in Battle Creek, Michigan, but moved to Knoxville when I was 2. And at that time, it was a small town of 120,000 people. Now it's a small town at close to 300,000 people and a community of 600, 700,000 in the surrounding counties. It's a university town with not a lot of large industry. It's mountains, lakes, wonderful people.
It's a beautiful area, that's for sure. I know that your wife, Lynn, was also raised here. Was she born in Knoxville?
Lynn was born in Knoxville and lived in the same house, in the same room, until I took her away when we got married.
Now, you told me that you were not only high school sweethearts, but you met at the very tender age of 3 years. Tell me about that.
Correct. Our parents were friends, and when we were 3, then at one of the social events that they both were present at, I met Lynn. Of course, she made a huge impact on me at age 3, but there was a little space in between 3 and about 14 or 15. Lynn has a twin brother, Bo, and Bo and I grew up to be best friends. And so I would go to see Bo until I got to be about 15, and then Lynn all of a sudden grew up, and I used to go see Bo to see Lynn. Classic story.
And the rest, as they say, is history.
Yeah, correct.
And then fast forward a few years, the two of you got married, and if my math is correct, you've been married for almost 60 years now.
58 years.
Congratulations.
And going strong.
Now, how did you end up in medicine to make that cut and sudden change of topic?
My dad was a physician, and both my brother and I admired him greatly. I can remember writing a little story in the 3rd grade, What Is It You Want to Do? The story of the 3rd grade. And I said, I want to be a physician like my dad so I can help people like he does. And I never wavered, not 1 inch. It was be a physician. I knew where I wanted to go, and I went.
Was he a primary care provider?
He was an internist who did a great deal of cardiology. He was Dr. Knoxville. I think he must have seen half the people in Knoxville and was a beloved, extraordinarily dedicated physician.
Now, I heard a story that you would have almost taken another path and become a professional football player. Is that true?
I had a strong interest in football, and I was recruited into the team at the University of Tennessee by General Robert Neyland. That was an experience. But I had a football injury just months before, and I was never able to really get over that. Back then, the treatment was so different. Right now, you probably could have continued, but at that time, I could not continue. And so my football career ended. However, it did allow me to focus on my studies, so I was able to short college years by 1 year. So medicine's a long career to get there, so that just took 1 year off of it.
And you went to do your undergraduate and your medical school work at the University of Tennessee?
Yes. I graduated from the medical school in Memphis at University of Tennessee in 1961. And from there, I went into an internship at the University of Michigan in Ann Arbor.
Now, I had mentioned during the introduction that Dr. Overholt is really the person who developed the flexible sigmoidoscope. And I have heard from him before that entire story really started with an interview after you had graduated from medical school. And I wonder if you could tell that story.
When I had just started my internship at Michigan and the Cuban crisis came. And we were all trying to get deferred from our military service so that we could complete our medical training. 1 week before I went to have an interview with the cancer control program of the Public Health Service, my dad had sent me an article from Life magazine about fiber optics. And in that article, it was mentioned flexible fiber optics would be developed. I knew I wanted gastroenterology at that time. So I went for the interview, and the gentleman that was sitting across from me, he said, "I'm here to interview you today, but you will have to excuse me because I'm extraordinarily uncomfortable." And he was doubled over, and he said, "I had a polyp in the descending colon, and 3 surgeons took 40-centimeter rigid sigmoidoscopes, 3 different surgeons, and tried to reach that. And they really hurt me, and I'm very uncomfortable." And I just spontaneously said, "What we need is a flexible fiber optic sigmoidoscope." And he sat up and he looked at me and he said, "What did you just say?" And I said, "A flexible fiber optic sigmoidoscope." And he said, "Well, never heard of that. Tell me about it." And I said, the wheels were turning. And that's when the design came. It came right at that moment. 4-way tip control, operating channel through which you could take biopsies, and a tip which directed water flow across the lens so that you could keep the field cleared in order to see. And it just happened just like that. And he said, "Come with me." And we went in to see his boss. The boss liked the idea. He said, "Go back to Michigan and talk to your professor, and if he is supportive, we'll develop that scope at the University of Michigan." That was in 1961. And it was contracted out by the government. There were 6 companies that applied. 4 actually were able to come up with prototypes. And one of those was clinically usable. And I used that for the first time in 1963. To my knowledge, it was the first ever flexible sigmoidoscopy performed.
How did that go?
Oh, well, it was a gentleman who had a known colon cancer in the descending colon, and we were trying to get up to take a look at it. Now, I was a first-year resident, and this was a scope with a wobble plate for control, and it was awkward, and the scopes were as big as my thumb. And so I kept working with that, and it took me about 45 minutes. Meanwhile, over my shoulder is this senior GI fellow, and he was assigned to watch this procedure and watch me and be sure I didn't do anything wrong. And so 45 minutes later, we finally got to this cancer and we could see it. The optics weren't all that great back then, but we could still see it. And he looked at me and he said, "Overholt, this scope will never go anywhere." And so, as you commented, that was not a very prophetic statement.
That turned out to be an utterly incorrect prophecy, I guess, considering that now there are millions of endoscopies being done every year and colon polyps detected, and as we all realize, cancers prevented, and it's just been an amazing development. But it was all there at that very first time. Four-way control, instrument channel, the optics, the lens washing. We're still using that same design.
That basic design persists today. It's been refined and improved, of course, but it's still the same principles.
And you were, of course, involved in some of that early improvement and refinement, and as I know, then went on to receive, appropriately so, a number of awards for your amazing work. The ASGE recognized that with their Schindler Award in 1975, and my math is correct, that still makes you the youngest Schindler Award winner at age 38 or 37 even. So that's pretty amazing. You, of course, went on to become ASGE president and have so many other accomplishments to your CV. But I want to talk a little bit about the following few years then. So you had done all this work. It's been a tremendous success at that point in time. I'm assuming at that point you can go anywhere you want to continue your academic career in GI. You made a decision to go back to your hometown of Knoxville. And I wonder if you can talk to us a little bit about how that came about.
Well, it was in 1969. I was at the end of my 4th year of GI fellowship, and I was trying to decide whether to go into practice or into academic medicine. I liked academia. I loved research, and I wanted to go back and develop that program at Michigan, and so things were very up in the air at that point. My brother-in-law one night called me and he said, now I get a little teary over this, so I apologize, but he said, "Gene, you can go, obviously you can go anywhere you want to go and you can do whatever you want to do, but if you come back to Knoxville, nobody will ever love you as much as we love you and your family." And so I cried and he cried, and the next morning I turned in my decision and came back to Knoxville. It was a wonderful decision. I've been able to have the best of both worlds, continuing research and clinical investigation, as well as a clinical practice.
I find that a very strong and powerful story to listen to, and I'm assuming some of the trainees that might be watching this video will hopefully too. The point being that there's more to a career and a life than figuring out the next step in your academic or any career, and considerations of family and where you want to live and who you want to be with are equally, if not more important.
I think I agree with that. The key to the decision in our case was that call from my brother-in-law, who basically said, the love of our family will surpass anything that you can accomplish in academic medicine. And he was correct.
Now, not surprisingly, you didn't lean back when you got back to Knoxville, but you leaned in and forward, and a few years later, I know you founded Knoxville Gastrointestinal Associates, which really now, thanks to your leadership, is one of the premier groups in this country. And you've led it for many years now, decades. I want to emphasize one point in time a few years later where I believe you and your group were the first to open a state licensed Medicare certified ambulatory endoscopy center. This is the first time really, I'm assuming, endoscopy gets moved out of the office and hospital environment into the ASC environment. How did that step come about?
In my work with ASGE, I traveled a fair amount in the early 80s, and I began to watch other physicians doing office endoscopy in their own office setting. And they were usually one-room facilities, but the idea clicked. And in 1980, we moved from our then existing building into a new building which had a 3-room endoscopic facility, 6-room recovery facility. About that time, I began to learn also that there was this entity called an ambulatory surgery center, and that there was compensation to cover your costs. And so I looked at that, and I went to the state of Tennessee and I said, I'd like to apply for a license for an ambulatory surgery center. And they basically looked at me and they said, what are you talking about? And I tried that 3 or 4 times, and I hit that stone wall every time. In 1985 and a half, the Tennessee Medicaid medical director came to visit me. She had heard me talk about this, and she said, I need to know what it is that you're talking about. And she knocked on the door one day and said, show it to me. And I took her back and showed her the facility and showed her a gentleman I just scoped, and he had a large ulcer, and I took a picture and showed her, and she looked at me and she said, who's going to pay for this? And she caught me totally off guard. And he was a poor farmer gentleman from Upper Tennessee, and I said, I don't know. I'm sorry. And she looked at the farmer and she said, how are you going to pay for this? He said, I can't. And she said, okay. And she walked out. And 2 weeks later, I got the license. And that wonderful woman, she was there to protect the interest of the poor. And since we were serving the poor and weren't really focused on the money part of it, she had it approved. And that's how it all happened. And then we began to teach others, and it's been a real change for the practice of gastroenterology, as you know.
It really has, and as you say, you started providing courses to really the rest of us, teaching the rest of the country how to put together these endo centers, how to run them, how to manage them. And there's now hundreds of them around the country, and they are really the model for high quality, high efficiency, low cost GI endoscopy care. So we owe you a great
well, it's been a
gratitude.
Wonderful opportunity to experience it, to see that growth occur and to see people improving care and saving lives and those things that we are all interested in.
Now, as if that hadn't been enough. You you then went on during or before or after that time to also do very important research. And for those of us who are active in private practice, we know there's no time for anything else. This is busy work. It seems to be getting busier every year. There's very little time for teaching, for research, but you were able during your time in your clinical practice for many years to direct a very busy research program, I understand, both basic and clinical research, starting with photodynamic therapy and laser-induced fluorescence. And it really laid the groundwork for how we treat Barrett's esophagus nowadays. And I'm just curious if that had always been your plan as you came back to Knoxville, or was there some fortuitous situation that made that possible? How were you able to do all that work in addition to everything else?
I always liked research, and I was always involved in clinical trials. I was at a hospital that could not support helping me with clinical research. But a board member came down and watched what I was doing with an endoscope, and he said, I flew over with IBM, I flew over a field, a cornfield, and we shot down ultrasound waves and collected that back up in the plane, and it would tell us what type of minerals were present and not present. And he said, can we do that through a scope? And so I began to get interested in the power of ultrasound, and it turned to laser. And once it turned to laser, I learned about photodynamic therapy because of the association power of the laser light and activation of a drug would produce a chemical that would destroy tissue. And at that time I was interested in Barrett's esophagus, and I was able to get funded for development of a program. We went to the vet school, we had a clinical program, and it was busy, and some things had to give and go. But I was able to continue that research in developing photodynamic therapy, which, as you said, was the first ablative therapy that showed scientific, statistically significant results, improving ablation of Barrett's high-grade dysplasia. Technology has improved since then, but that opened the door.
Mm-hmm. And those studies were done by you and others,
yes,
showing that indeed is effective and is worth developing and studying further.
Just as an aside, the durability of the ablation effect of photodynamic therapy over time is better than the durability of ablation with RFA over time, because it simply went deeper. Mm-hmm. I used to create some really awful looking things. And the strictures I created were terrible, but when you got through and the patient was dilated and so forth over time, it was wonderful to see.
I'm curious if I asked you, looking back, what your most successful, your most important maybe contribution to the field of medicine and gastroenterology might be. Have we touched on that yet, no, or are there other things that you regard as very important?
I think the most impactful, the most important thing that I have done in medicine was pointed out to me by a patient. And it was a patient with Barrett's and high-grade dysplasia, multifocal, and we treated him with PDT, photodynamic therapy. And at that time, I had matured enough to where I was comfortable in praying with my patients before this horrendous procedure. They came to me scared, trembling, worried, not knowing what to expect. Even though we had done a lot of education, they did not know what to expect. Prior to the procedure, I would say a short prayer with them. And it was basically praying to God for their healing, both body and soul. And during that prayer, you could just see these people calm down. And so they were then ready. Well, this particular gentleman, he kept coming back, and 10 years later, he and I were talking, we became friends, and he said, Overholt, I remember a little bit about that treatment. It hurt for a few weeks, but I got over that, and I was sensitive to the sunlight for 2 or 3 weeks, and I got over that. I remember those, but what I really remember is the prayer. That is the most meaningful thing that I have done in my practice, is to be able to pray with patients who are in terrible emotional distress at that point. And it's been, hands down, the best thing I've done in my entire career.
Thank you for bringing that up. That is extremely interesting. To me, that's a reminder also largely that we in GI endoscopy, we practice in a very technically oriented specialty. And we do a lot of good doing GI endoscopy, and we have a lot of tricks up our sleeves, but ultimately what's also important, and maybe if not equally, then maybe even more important, is to not forget the patient and the physician-patient relationship and everything we can do for the patient around the time of endoscopy in terms of alleviating their fears and helping them through those GI endoscopic procedures.
Yes.
Gene, we've taken quite a bit of time talking about your career and all your accomplishments. I want to spend the last couple of minutes, if I may, to give you an opportunity to maybe reflect on it from the perspective of what would you tell young trainees, GI fellows and recent graduates, in terms of what they should do, what career advice do you have? Are there things in hindsight you would do differently, you might do better than you've done them? What sort of tips do you have for them?
We have all been asked that question, and we've all thought about it. And there's no single simple answer. I've thought about it a lot, and I have a litany of responses to that. And first thing for physicians is to get the very best training and education that you can, and continue that education and training throughout your entire professional career. Another thing is to work hard. Work harder than the guy next to you. Become part of the team that delivers care to the patient. On that team, do more than your share. Go that extra mile. Be a major contributor for the patient care. Another thing is wear a smile. Have a positive attitude. No one likes to see you grumpy, and no one likes anybody with a negative attitude. So when you join that team, bring something positive to the team, a smile, and a smile to your patients. and a positive attitude about your career. Another thing is treat your staff as extra special people, because they are. Second to the physician's own personal training and pattern of care, the single most important thing toward the success of a practice and a physician is the quality of staff that that physician works with. They're special people and they need to be treated as such. In terms of addressing the care of the patient, my dad taught me and my brother the most single important thing that you can do, and I believe this, is listen to your patients. If you truly listen, 80% of the time, they'll tell you their diagnosis just from the history alone. Another thing that he taught us is during the patient's visit to you, always, appropriately, place your hand on that patient. Shake their hand, help them into the chair, examine an abdomen, but always touch the patient, as long, of course, as it's appropriate. A healing hand on a patient is very reassuring to people. And I've practiced that my entire career, and I firmly believe that's the case. Too often now, you walk into a room, you take a little bit of a history, you cut the patient off, you go order a test.
Sit down in front of the computer and you just start typing.
Yes, that's not the way to go. There are things outside of being a physician that you need to look at. Also, the young physician needs to look at. Honor your spouse. That's the most important person in your life here on earth is your spouse. Always take time to care for your family. Spend good time with them. Other things that have crossed my mind, be flexible. Be ready for change. Change is going to occur and you might as well get ready for it, because it's going to happen, it is happening, and you either adjust to it and go with it, or you oppose it and get left behind. You've been blessed to become a physician. Pass that blessing on to patients who aren't as fortunate as you. Klaus, those are just some of the things that come to mind. There are more. Maintain without question your integrity. Tell the truth. Do what's right. Never make a clinical decision for a patient based on money. It always has to be for the right of the patient's care. It's a major opportunity and a major responsibility that we all, as physicians, share. And that's taking the right care of the patient. So, those are some of my thoughts on that.
Well, that's fantastic advice, and I've really learned so much from those last few minutes. So I appreciate you providing all of those thoughts. Gene, I think we're at the end of our time here. It's been an absolute pleasure and really an honor to talk to you today, and I really appreciate you making that time for us. I hope you will stay involved and keep teaching all of us, and we'll see a lot of you at conferences and no doubt around Knoxville here in the future.
Thank you, Klaus. It's been a real privilege, and it's not often that I get an audience where I can tell all of my stuff. So thank you very much for the opportunity. It's an honor.